Pituitary hypothalamus point. Start with the flat pad of your middle finger and place it on the client's forehead. Locate the ridge between the eyebrows and find a small soft spot slightly superior from where the brows come together. Using the flat pad of your finger, slowly apply pressure. Your direction of pressure is anterior to posterior. Maintain the pressure long enough for the client to register any sensations. Record the client's response. Ragland's postural hypotension test for the adrenals. For the first part of this test, begin with your client in a supine position and take their resting blood pressure. Record both the systolic and the diastolic readings. Prepare for the second part of this test by asking your client to move closer to the edge of the table. Next, establish a supportive elbow-to-elbow hold, which will ensure your client's safety in standing if they become dizzy. Once this is established, proceed to inflate the cuff 15 to 20 units of pressure higher than the first systolic reading. While supporting your client's arm and shoulder, have your client swing their legs around and stand up quickly. Once their feet hit the floor, release the blood pressure cuff valve to get the second systolic blood pressure reading. As an important note for accuracy, this reading should be taken within 5 seconds of your client's feet hitting the floor. Record the systolic reading only and compare systolic results referring to the rating scale. Posterior ilium leg length test for the adrenals. Begin with your client supine with their legs in a neutral position. First, apply light traction to help even out both legs by holding the lower calves just above the ankles and gently pulling the legs towards you without lifting the feet off the table. Next, place your thumbs on the arches of your client's feet and wrap your fingers around the top. Flex their feet back into a neutral position so that their toes are pointing towards the ceiling. This pressure drives the femur into the hip socket, allowing us to assess if there is any discrepancy in leg length. Looking down and assessing the calcaneus, which is the bottom aspect of the heel, we can determine if there is a difference in leg length. Record the results. Note that the medial malleoli or ankle bones are not reliable measures for this test due to common injuries and scar tissues. Inguinal ligament palpation test for the adrenals. For this test, we are palpating the inguinal ligament, which is in a sensitive area. We always need to get specific permission from our clients before proceeding with this palpation. One way you can do this is to first show your client on your own body where this ligament is located and where you'll be palpating. After this demonstration, ask your client if they are comfortable proceeding with this test. If your client is not comfortable or hesitant, you can always skip this test and move on to the next. We always honor the client's comfort level. Make note that we take this approach with any palpation in a sensitive area. First, showing the client the location of the palpation and then asking for permission to proceed. The inguinal ligament runs between the ASIS and the lateral edge of the pubic bone. Once you have established permission to proceed, find the landmark for this point, which is the ASIS. Using the flat pads of 3 reinforced fingers, move medial and slightly inferior of the ASIS and your fingers will be perpendicular to the ligament. Staying close to the landmark, apply gentle pressure anterior to posterior, slowly rolling back and forth over the ligament. You may notice a difference in ligament tension and tenderness between the two sides. Record your client's responses and your own observations. Chapman's reflex for the adrenals. The landmark for this palpation is the umbilicus. From here, move 1 anatomical inch lateral and 2 anatomical inches superior. This is a one-finger palpation using the tip of each middle finger. Remember, you can always reinforce the fingers, keeping a slight natural curve of the hand to avoid hyperextension. These reflexes are specific points located on the muscle tissue, not in the abdominal cavity. Instruct your client to engage their abdominal muscles by lifting their head slightly to gaze at their toes. The direction of pressure is anterior to posterior, palpating each side individually. Record your client's responses. On a safety note, clients with neck issues may not be able to lift their head for this palpation. An alternative option is to have your client tighten their abdominal muscles without lifting their head. Chapman's reflex for the pancreas. The landmark for this palpation is the xiphoid process. After finding the xiphoid process, move lateral to the right and you will be on the 7th rib. From here, move inferior into the right 7th intercostal space. To find this specific point, move medial in the intercostal space until you come to the margin of the rib cage. The pancreas point is found in the most medial area of the 7th intercostal space. Your direction of pressure is anterior to posterior. This is a one-finger reinforced palpation using the tip of your middle finger. Record the client's response. Remember, you can always do a quick check to determine if you are in the correct intercostal space. If you move medially and land on the sternum, this would mean that you're in the 6th intercostal space. If you land in the abdominal cavity, you are in the 7th intercostal space. Use this quick check whenever needed. Right 3rd rib for the liver. The landmark for this point is the clavicle. From here, move inferior, counting down until you find the right 3rd rib. It's easiest to count down the rib staying close to the sternum where there is less tissue. Note that the 1st rib is tucked under the clavicle, so drop down until you land on the next rib. This is the 2nd rib. Once you have landed on the 3rd rib near the sternum, move lateral, locating the chondrocostal junction where the cartilage turns to bone. This is at the midclavicular line. This palpation is a one-finger reinforced palpation using the tip of your middle finger. Your direction of pressure is anterior to posterior on the anterior surface of the 3rd rib. Record your client's response. Make note that this test can also be performed with the client in a seated position. Proceed with the same palpation instructions, noticing that the practitioner must adjust their stance to support the back of the client's right shoulder with the palm of their left hand, while applying pressure to this point. This supportive stance ensures a consistent, effective palpation each time. Chapman's reflex for the liver gallbladder. The landmark for this palpation is the xiphoid process. After finding the xiphoid process, move lateral to the right and you will be on the 7th rib. From here, move superior into the 6th intercostal space at the midclavicular line. This is a one-finger reinforced palpation using the tip of your middle finger. Your direction of pressure is anterior to posterior. Record the client's response. Remember, you can always do a quick check to determine if you are in the correct intercostal space. If you move medially and land on the sternum, this would mean that you're in the 6th intercostal space. If you land in the abdominal cavity, you are in the 7th intercostal space. Use this quick check whenever needed. Murphy's sign for the liver gallbladder. Begin by positioning your body on the client's left side with your body angled towards the client's right shoulder. Have your client bend their knees with the soles of their feet flat on the table. Locate the xiphoid process on the right side of the rib cage and find the midpoint of the curvature of the medial costal margin. Place your fingertips 1 to 2 anatomical inches away from the curvature of the ribs, with your fingertips pointing towards your client's right shoulder at approximately a 45-degree angle. This is a 3-finger reinforced palpation starting with the flat pads of your fingers. Once you're in position, you will direct your client with 3 breaths. With the first breath, your client takes a deep inhale, and as they exhale, sink slowly into the tissue, anterior to posterior. Ask your client to take a second breath, and as they inhale, allow your hands to move with the expansion of their diaphragm. And as they exhale, sink slightly deeper A to P. At the end of the exhale, change the direction of pressure to inferior to superior, moving up and under their rib cage, angling diagonally towards their right shoulder. Hold this palpation as you direct your client to take a third breath, which allows the diaphragm to push the liver and gallbladder into your fingertips. During this inhale, ask your client to evaluate tenderness. Once they have given you a rating, slowly remove your hands and record the results.